What is tardive dyskinesia? My name is Dr. Dutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as the importance of safety prescribing when clinically appropriate. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. And one of the questions that has come up a few times is asking for more information about tardive dyskinesia. So tardive dyskinesia is an extrapyramidal symptom or medication-induced movement disorder that typically occurs over time. However, there certainly are cases where this can develop after a relatively short period amount of time. So what medications can cause this? We're most commonly thinking about the antipsychotics, so especially the typical antipsychotics or first generation antipsychotics. These are things like Haldol, Prolixin, Thorazine. However, it can also occur with the atypical or second generation antipsychotics, things like risperidone, Geodon, olanzapine. And what does it look like exactly? Well, it's uncontrolled and repetitive muscle movements that happen. Typically, it happens in the face or the jaw region, so that could look like lip smacking, chewing, tongue protrusion, but it can occur in any body part. So it could be in your hands, your trunk, your feet, your legs. And it's not only a nuisance, but for some people, it can be really debilitating because these movements can be really large. They can cause injury, muscle issues, and just the inability to sit still. Sometimes people aren't able to consume enough calories in order to be able to maintain their weight because of the constant movement. So what can we do about this? Well, we do treat with anticholinergic medications, things like benztropine, otherwise known as cogentin, or diphenhydramine, otherwise known as Benadryl. Sometimes these are prescribed prophylactically with a medication before they start to develop any extrapyramidal symptoms. However, I prefer not to start this medication until some extrapyramidal symptom has manifested because, one, I don't like them to be on more medications than are necessary. Two, I always try to use the lowest effective and tolerated dose. And three, if these medications are on board, then I may not be able to tell that someone is vulnerable to or already developing EPS until the medication is stopped or decreased for some reason. Now, this is a good option for younger individuals. However, in older individuals who may already have cognitive vulnerabilities, the anticholinergic effect of these medications can make their cognition worse and can cause things like altered mental status. So it's not really a good option in the elderly population. So what else can we do? The FDA relatively recently approved a medication class called VMAT2 inhibitors, and these are FDA approved specifically for the treatment of tardive dyskinesia. And my experience with them is that they can show some initial benefit, but that this benefit tends to wane over time and it's not sustained. A lot of times it can also be hard to get insurance to cover this medication, and it is quite expensive. So I don't see that as the answer to TD. Another potential treatment is using Botox injections. So if someone's having recurrent movements, muscle contractions, and it's really causing them issues, then a Botox injection could help to paralyze that muscle temporarily. But ideally, if someone develops this, I want to either reduce the dosage to a dose that's not causing these symptoms, or I want to transition to a different antipsychotic that has less risk of these symptoms. But I say these things with a couple of caveats. One, if you reduce a dosage too quickly, it can actually make the tardive dyskinesia worse. And two, for other people, the tardive dyskinesia persists even despite decreasing the dosage or stopping a medication. I should also mention that it's not only antipsychotic medications that can cause this. Things like SSRIs and some mood stabilizers can also cause this, as well as some somatic medications like Reglan, otherwise known as metoclopramide, which is an anti-nausea medication. If you've had any experience with tardive dyskinesia and you want to share, please put it in the comments below. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings or resources that I want to be able to communicate with you all directly about. So if that's you, then send me a DM with your email and I'll see you in the next one.